হয় কিভাবে একটা অনেস্টলি রিসার্চের মধ্যে কিন্তু অনেক ধরনের ব্যাপার আছে। বিশেষ করে আমাদের বাংলাদেশে যে একটা প্রচলন চালু হয়ে গেছে সেটা হলো যে পোস্ট গ্রাজুয়েট স্টুডেন্ট বাংলাদেশে বিভিন্ন কোম্পানি তৈরি হয়ে গেছে যে ওদেরকে কন্ট্রাক্টে ওরা রিসার্চ করে দেয় যে তোমার একটা প্রোটোকল সুন্দর মতন কারোর থিসিস লাগবে কিংবা ডিজার্টেশন লাগবে, একটা প্রতিষ্ঠানকে সে কন্ট্রাক্ট দিয়ে দিচ্ছে, খালি এদিকে প্রোটোকল লিখে পাস করে আনলে সুন্দর মতন 3 মাস পরে সে একটা থিসিস একটা পেপার রেডি করে দিচ্ছে। তো এই জায়গাটা থেকে আমাদের বেরিয়ে আসতে হবে, ঠিক আছে? বেসিক রিসার্চ করার প্রতি আগ্রহ আসতে হবে। তো আমাদের রিসার্চের জায়গার অভাব নাই। যে যে পজিশনে আছে ফার্স্ট ইয়ার, সেকেন্ড ইয়ার, থার্ড ইয়ারের এদের এক ধরনের চিন্তা ভাবনা থাকবে প্রি ক্লিনিক্যাল ইয়ারে কি ধরনের রিসার্চ করা যায়, আবার পাবলিক হেলথ যখন কমিউনিটি মেডিসিন করবে তখন এক ধরনের রিসার্চের চিন্তা করা যাবে, আবার যখন ক্লিনিক্যাল ইয়ারে আসবে তখন ক্লিনিক্যাল ইয়ারে কিভাবে রিসার্চ করা যায়। স্টুডেন্ট লাইফে এই যে রিসার্চের প্রতি আগ্রহ আসতেছে এবং রিসার্চ সামনে করার যে প্রবণতা বাড়ছে, এটা খুবই একটা পজিটিভ জিনিস। তো থ্যাংক ইউ ভেরি মাচ আমাকে কিছু বলার সুযোগ দেওয়ার জন্য। আমি আজকের এই স্পেশালি আই নো ইউ আর অল আর ওয়েটিং ফর দিস প্রেজেন্টেশন। সো আমি আমার মনে হয় মহিউদ্দিন স্যারকে অনুরোধ করবো স্যার তার লেকচারটা শুরু করুন, সবাই মনোযোগ দিয়ে শুনুন। আমি হয়তো কন্টিনিউ করতে পারবো না, আমার আরো একটা অ্যাসাইনমেন্ট আছে। থ্যাংক ইউ ভেরি মাচ। থ্যাংক ইউ ভেরি মাচ।
Right. Hello, everyone. Assalamu alaikum. My name is Siyum Mohiuddin. I am a student from Dalhousie, New Brunswick, class of 2027. So I want to apologize in advance for doing this presentation in English. Our only conversation about the party, so I figured if I want to get the point across, I'll do it in English, but I've been assured that everyone here will be able to follow along. So I'm doing this presentation on behalf of my Baba, Dr. Mohiuddin, who's a radiation oncologist. He's CMC batch 24. My family and I are here on winter holiday, seeing our family, and he asked if I wanted to present my research endeavors to the Chittagong Medical College, and I said yes, absolutely. And also I want to excuse, I have a little cough too, so every now and then I'm going to cough. Okay. All right, so let's get started. About me. So I moved to St. John, New Brunswick, Canada in 2007. I was originally born in South Africa, Johannesburg, when my dad was doing his training there. And I moved there in 2007, hence the Canadian accent and all that. I did my school, high school, everything there, and I did my Bachelor of Science in Kinesiology from University of New Brunswick, Fredericton, and finished that in 2022. Kinesiology, if you don't know, is the scientific study of human movement, kinetics. So I don't know if a lot of you know this, but in USA, Canada, you have to do a BSc before you go into MD. So it's 4 years, and then you do another 4 years of medical school. I know here in Bangladesh and a lot of schools in Australia and UK, you can go into medical school right after you finish your high school, which I would have preferred, but I had to do a BSc first. I didn't get it right away. I had 1 year off where I did work at another hospital in Fredericton called Dr. Edward Chalmers Hospital, where I was a research assistant for pharmacy, and my research was in regards to patient discharge and readmission, so I did that job for 1 year, and then I applied again, and I got into Dalhousie Medicine, New Brunswick. So I'm sure some of you are Googling it. Dalhousie's main campus is in Halifax, Nova Scotia, and then they have a satellite campus in St. John, New Brunswick. So Nova Scotia is a province east coast of Canada, and then we're just right beside it. When we have a much smaller population, and our class is only like 40 students every year. So currently I'm in my second year of medical school, which is your equivalent of 4 years. So Med 2, you guys are, I'm assuming a lot of you are Med 5 and 4. And I have 2 more years left before I start my residency training program. Okay. So this is up top on the left is the Dr. Everett Chalmers Hospital. That is where I used to work at during doing my pharmacy research. On the right is St. John Regional Hospital. That's where, like for example, you guys have your CMC hospital right here. That's our teaching hospital. And then the bottom left is Dalhousie Medicine, New Brunswick. So that's currently where I'm learning. It's a very small building. Like I said, we only have 40 students coming in every year. So I don't know how many students do you guys have every year?
Every batch. In every batch 250?
250, yeah.
In our batch, but right now it's coming to 300.
300, yeah, well, no, nowhere near. So we're 40 students in New Brunswick, and then Halifax, they have 120 students. So we have every year it's like 170 students, but our school's only 40, and in our small province of New Brunswick, if you're Googling, where New Brunswick only has 800,000 people, and my city only has 70,000 people, and I think only 3 Bangladeshis right now in this medical school. Okay, so I'm doing this presentation with the topic being research in medicine. So I understand that there isn't a set research program for you guys here. You guys have some group project that you do in your 3rd year. So for us, we have a program called RIM, so Research in Medicine at Dalhousie. So RIM is a mandatory course we all have to do, and it's one of the things Dalhousie advertises when we're applying, and every student has to do it before they finish medical school. It's a self-directed program, meaning we can do it at our own pace. We can finish our project in 1st year of medical, or we can finish it in the last year in our 4th year. But basically, it's do it at your own pace. The purpose behind RIM is that they want to instill a culture of doing research like consistently as a doctor. Because once you go into clinical practice, a lot of your guidelines and recommendations are based on research. And Canada, and especially Dalhousie, is very proud of all the research that they accomplished. So to instill that, they started the Research in Medicine program so that students are motivated to do research. A lot of students go in, including myself. I wanted to just do clinical studies, and I didn't want to do anything to do with research, but in my undergrad, because I was at Dal, I had to start doing some research, and then after doing it for a while, I really started to enjoy it. But the main point of it is to make us be okay with starting a project, finishing a project, being able to implement any study, like outcomes that we see from studies, and just be a lifelong learner. Because as a physician, you'll be constantly learning, you'll be seeing new recommendations coming out throughout your practice, and therefore, whether you like it or not, research is always going to be there. So our role as a student, whenever we begin at Dalhousie, you don't have to do this right away, but we need to find a mentor that'll help us do our research project. We have to develop and propose like a project in the area of our, not our specialty, in the area of our interest. And then we pick one summer, either your 1st year summer or 2nd year summer, to do the grunt work of your research, like most of the data collection. And then we have to submit to and present at a conference. We have to submit a manuscript, and the form of research can be anything. It can be a poster, interview, podcast, which I'll talk about more so later. But basically, that's our role. It seems like a lot at first, but there's a lot of people in my class that don't particularly love doing research, which is perfectly fine, and then they can get away with doing like a small project, whether it's just doing a small interview or a podcast, as long as they're submitting something. Not everybody has a chance to submit at a conference, so Dalhousie has a Research in Medicine Day where they can present their research there, and the summer studentship that we get, we have to pick one summer. So I did mine this past summer. I got my data collection done, and Dalhousie pays us a little bit of money to, not work and focus on our research so that everybody has a chance to get their data collection done. So, like I mentioned, why do we do RIM? Like I said, it encourages us to continue to be involved in research, not just in medical school, but once we're in residency, once we go into working as an attending at a hospital. A lot of the hospitals in Canada a lot of the main ones you'll see are teaching hospitals. So when you finish residency and you start working at a major hospital like the one that I'm at St. John Regional, or if you hear about Toronto, Vancouver, you work at those hospitals, you're instantly an assistant professor. So you are involved with teaching, you have to be involved in some sort of research. Therefore, it's really important to start doing research early on in your medical school career. Another thing is that it helps us build our CVs or our resumes. And so the way it works in Canada is that once we finish medical school, we have to apply to residency programs. I'm sure it's similar here. And they really have a focus on research, like research projects. They want to see that you've been involved in some research. They want to see that you can start a project and finish a project because it helps them decide who they select into their residency programs and whether these students will continue to do research for those programs. So it's an important thing to have. A lot of people can do all 4 years of medical school without doing any research, but you're at a disadvantage when you're applying. They don't want to see they don't want to just see that you have a lot of shadowing hours, or grades don't even matter there. It's all pass or fail, so they don't even see your grades. But research is important. If you're applying to, like, say, neurosurgery or something competitive like that, you need to have a lot of research. I think one of my friends, Matt, he began his neurosurgery residency this year, and he had like 11 publications before he applied. And I'm not going to have 11 publications when I apply. I don't plan to do that. But for something that competitive, you need to have a lot of research. And like I said, doing research in medicine instills lifelong learning. It motivates us to read articles and stay up to date with new recommendations and guidelines, because when we're practicing and we're delivering care to our patients, we want to provide them with the most up-to-date care. So yeah, like I said, research is extremely important, and that's why Dalhousie really focuses on implementing a research program in medical school. So what is my research project? So there's also graphic pictures coming up. Just in case you're all medical students, so it's okay. So my project is with orthopedic surgery. It's called Identifying the Optimal Position for a Minimally Invasive First Metatarsal Osteotomy for hallux valgus reconstruction, and it's a cadaveric study. So hallux valgus is the bunion on your first big toe, and the way they correct it is through an operation that basically just cuts the toe and straightens it out, just to put it simply. And my preceptor, who's an orthopedic surgeon, wants to find specific measurements that he can provide to other surgeons so that when they perform the operation, it limits the damage that comes to the capsule of the distal metatarsal. It limits the damage to the vasculature of the metatarsal, so that when patients are healing, there's better patient outcomes, less effusion, and all that. So I'm going to explain to you guys how I started my project, what I did to understand it, because when I started this, I was only in my first year of medical, so I didn't have a full understanding of any orthopedic surgery-related research. I knew anatomy because I had done it in kinesiology, but I was very lost at the start. But my project, before I started, like I just mentioned here, is in collaboration with the Department of Orthopedic Surgery. We have in the St. John Regional Hospital, there's an institution called Canada East Foot and Ankle that's just research only for foot and ankle related research with orthopedic surgery. There's the Dalhousie, like my school, Dalhousie has a body donation program for cadavers. and Dalhousie University, and Horizon Health New Brunswick is the hospital corporation. So how did I begin my project? So the first thing I did was I reached out to Canada East Foot and Ankle, I think the first 2 months when I began medical school, wrote them an email and said, hello, my name is Siyum. I used to volunteer with them when I was in university. I mentioned that I used to be a volunteer. I'm starting medical school and I'm hoping to do a RIM project with them, a research in medicine project with them. So I got a meeting with the research director, and research director of Canada East Foot and Ankle is one person who manages the research that happens with all the doctors in that hospital. So she connected me with my preceptor, the orthopedic surgeon, and we all had a meeting together. So when it comes to research, another thing is too, like, a lot of us as students, we don't have a lot of information yet regarding what kind of research you even want to do. You know what I mean? You don't know enough science yet, or medical science yet, to even make a research project. So this project idea was my preceptor's idea, and basically the preceptor, like the orthopedic surgeon, just needs someone to help them write the paper and do all that work that they don't want to do because they're in the OR working all the time. So he had several ideas, and one of them was the hallux valgus, providing recommendations or guidelines for surgeons. So we discussed the project, and then after that after I understand what the project is, what my project is going to be with him, I have to submit to our research ethics board. So we have to do an REB submission to our to the hospital so that we can begin our project. And in doing the REB, it basically explains what we're going to be doing, who is going to be affected, what corporations are involved so that they can protect themselves and make sure that we're doing research the right way and that nothing, we're not cutting corners or anything like that. It's a quality assurance program, and any project you start, no matter, we're not working with live patients, we're working with cadavers, you still have to do an REB. You're not working with anybody, you still have to do a research ethics board REB submission. So that way they can ensure that all the research that they're doing is ethically, morally good. So after we discussed what we wanted to do, I submitted the REB, and it's just this form that I get off from our hospital website. I explain everything we're doing. Am I making money from this project? No. The population involved is cadavers. Live patients aren't involved. I'm not advertising corporations, medical equipment, or anything like that. And what are we going to do with the data? We're going to submit it to journals, and we're hoping to provide guidelines to surgeons. So before any of this, like I said, I didn't know a lot about orthopedic surgery or orthopedic research. I had to do a literature search to see if there was already any existing research regarding this topic. So if I'm going to do a project, if you're going to do a project and you're writing it and you're doing it and you do all this work and you see there's already a number of papers on it, then there's no point. The data is already there. So before you do any of the hard work, you need to do a literature search to make sure that, let's see what areas they've already covered. And if you find holes, then you can focus your research on covering those areas. And you mention it in your journal, like in the introduction you mentioned, these people did this research, but they didn't look at this specific area, and that's what my project is doing. So this is my first time doing a literature search. I mentioned that I worked with pharmacy before, but that job was like nowhere near as research intensive as like this. But to do a literature search, I don't just Google hallux valgus on Google and see what comes up. That's what I thought we had to do. But there's a specific way to search up specific key terms to understand, so that you can get all the papers that were written regarding this project. So, for example, hallux valgus, minimally invasive surgery, like foot and ankle recommendations. Those are specific guidelines and keywords that I had to use to search up what papers were already made or what relevant papers there are already in regards to my project. We at Dalhousie were fortunate enough to have a research librarian who helped me with the search, and she helped formulate the key terms so that when I press search on PubMed, everything that is relevant in regards to my paper comes up. And I think it was like, because if I just search up hallux valgus on PubMed, you'll see 1,000 papers on it. But if I search up hallux valgus, MIS, bunionectomy, all these things, then you'll get 11 papers or 8 papers, and it helps you narrow and focus your search. And everything in regards to what was published will be here. So I use PubMed. There's a lot of other journal search programs out there, and to learn how to use the search engine, just go on YouTube. A lot of videos on there on how to help you to formulate your search. Very specific, and it's out of my expertise, so we're fortunate enough to have someone we can reach out to help us with the search. And like I said, the goal is just to find existing research and make sure that you're not duplicating a project, and make sure that what you're researching can add to the scope of the literature. Because when you submit, like later on, to a journal, you want to, the journal will only take you in if it's actually adding to the current existing knowledge. So after we did the literature search, I understood, okay, there's no papers on the effect of minimally invasive surgery on the vasculature. There's no papers on the effect of the capsule. There's currently 4 generations of minimally invasive surgery for hallux valgus, and there's only papers on the first 3 generations of the operation, not the 4th generation. So I was okay, that's the thing I'll focus on, the 4th generation of the operation. That's the operation that my preceptor does mostly, and so we'll provide the guidelines for this 4th generation. So next, the data analysis, and this is the worst part. I hate doing data analysis. I hate any math or anything like that. Fortunately, we also have a data researcher on campus, and I know a lot of these compared to CMC, which is a very resource-limited area, that you don't get a lot of this help here. So, which I understand. But when it comes to doing research, just understand that later on in your careers, whether you're in an educational institution, to use these resources, because you're going to be super busy with your clinical work, families, and all that stuff, and you're going to want to do research, and you'll have a whole arsenal of students at your disposal that can help you write these papers. And if you are able to get into that field, then make sure that there's also someone that just focuses on doing data analysis. So we, at the end of East, Foot, and Ankle, there's people that they hire that just do data. They're not doctors or anything, they just do data analysis. I don't know how to do data analysis. I don't know how to use that program. There's IBM SPSS. It's basically Excel, but super fancy. I didn't know why we couldn't just use Excel, but my research supervisor was like, you have to use SPSS. So I'm okay. So we had someone help me do the data analysis, because in our project, we took 10 cadaver feet, we did a lot of measurements, and the measurements were done between the orthopedic surgeon. There was an anatomist too, so they wanted to compare to see how significantly close their data was, and there's certain coefficients you have to calculate, and so for me, this was way out of my expertise, so I reached out to someone there to help me out and formulate a plan. And these are things that I'm also including in my paper as well. Because when you write a paper, you have to include, your introduction, your methods. You have to include how you did the data analysis, what steps were taken in place, and how everything was done, so that when you're submitting, people can recreate your research if needed. So just another warning for the next slide. There's graphic pictures coming up, but so now this was time for me to do my data collection at the hospital. So in the hospital, we have an anatomy lab in the basement, and we have cadaver specimens that we ordered. We ordered 10 specimens, and in the summer, so I did my data collection this past summer. There's 2 weeks of data collection from the 10 cadavers. And since this was an organization, McKinney's Foot and Ankle, there was 4 other papers that they did from these 10 cadavers just to maximize their use and obviously respect their use because, you know, we're cutting into these cadavers, we're removing toes, we're looking at different anatomical landmarks. You want to get as much use out of these cadavers as possible. So my paper was one of 4 papers being written, and the pictures don't really matter. I can just tell you what we're doing. So the top picture, we're injecting pink dye into the arteries so that when we dissect, the latex and the dye like hardens, and then we can see the arteries to see what arteries were damaged during the operation. The anatomist who runs the lab, he dissected the toe, the distal first metatarsal joint capsule to see if there was any damage to the joint capsule, and then at the bottom we were looking at the plantar artery to see if there's any damage. And then we took X-ray images. You can see the joint capsule is outlined in black because we injected a radio opaque dye so that we can outline the capsule boundary. And then those are images that we also submit with our paper. But this was 2 weeks of data collection in the summer, which it's not a lot of work. We had a lot of help. We have other students, my peers, you and your friends might be doing a project together. We all put our names on each other's papers too when we're helping each other. So this was 2 weeks. We had to get it done in 2 weeks because they're not going to stay fresh forever. And we got as much data collection done. And when we were done with the cadavers, we got to practice our suturing, which was pretty nice. So after that, I have my data. I did the data analysis. I have everything I need to write my paper. And now this is the hardest part for me because I hate writing papers, data analysis, all that stuff. But it's the work that is necessary to do, at our age and at the point we're at in our careers. And then we have to disseminate and do our knowledge translation, so present it. So the next thing I did was I presented. This is preliminary research. So I did this in December. So I did this last month, 6 weeks ago. I did it in Moncton, New Brunswick, which is another city in our province. They have a health research symposium. At this point, my paper's not done. I only have data. I have the numbers and everything I need. But there's different conferences that happen throughout the year, and you can just go and present your data early if you need to. You don't need to have a paper done. This conference is pretty accepting of a lot of papers. They take whatever because they want to fill their booths with as much papers as possible. And I also submitted to the Canadian Orthopedic Association, which I'm going to hear from next month. Hopefully that they will take my paper in. But these conferences, the reason why I'm showing you them is that you guys will have, I'm sure here in Chittagong, Taka, wherever, you have a lot of little conferences and presentations that happen. If you have research projects or you have something you want to present, just go and present. And you can throw it onto your CV. It looks really good. They don't care what you're presenting at as long as they saw, like you presented at some conference, it looks good. Obviously later on, they might expect, later on in your career, you want to be presenting at much higher level conferences, but at our level now, I try to present wherever I can. So I submitted to this one and presented, and I'm hoping to submit the Canadian Orthopedic Association. I'm hoping they let me present, and that's at the next level up conference that would happen next year in Vancouver. So, like I said, I have preliminary data, but my paper's not done. I didn't start writing my paper until last month when my preceptor emailed me and asked me where's the paper. So okay, and I started writing it. And I'm currently still writing it, and my goal is to submit to Foot and Ankle International. Right now, we already changed the title for it, so now it's Landmarking an Extracapsular Position. And when you're writing a manuscript, there's multiple drafts and edits that are happening. So I'll do an edit, send it to my preceptor, he'll send it back, I send it back and forth. So that's what we're doing. So right before I came to Bangladesh, I sent him my draft, and hopefully he sends it to me back soon, and we'll keep working on it and submit and hopefully be able to have a published manuscript so that I can throw that on my CV and say that I submitted to a journal and got it published. So this was my current journey with research. I'm currently doing one project. I'm hoping to get this submitted, and since I'm finishing a bit earlier than a lot of my peers, I'm hoping to do another project as well, because by the time I apply to residency programs, I want to have at least 2 projects under my name that I can say, okay, I did these 2 research projects, and hopefully, that can help boost my CV compared to other students. So now we're going to move on to how you can get started as a medical student, how you can start doing research. And full disclosure, I don't know how your system works. This is just recommendations that, from my experience, for general things that you could do. First thing is to find a preceptor, whether it's a physician, a professor that you have, someone that has a knack for research, they have projects that are going, build a relationship with them. So, introduce yourselves, explain, I am second, third year med student, I am interested in orthopedic surgery, I'm interested in radiology, whatever, and I want to do a research project. Try to find out those people here, see, I know you guys have a lot of physicians in the hospital that I'm sure they did programs internationally. Find out from them if they're doing any research or if they know any research happening around. So just be very inquisitive. Don't be afraid to ask questions. You guys we're all med students. All we do is ask questions. So go around asking people what projects are happening. Next thing is you need to understand the CMC research guidelines, like the government guidelines, what the rules are in regards to doing research. So for us, they have very strict rules. We can't just go and start a project. We can't just go start interviewing people or cutting into cadavers unless it's approved by our research ethics board, it's approved by my preceptor. So find out what your college's rules are, make sure you're following all the guidelines, and make sure you're submitting the proper applications to the proper people. Next thing is to search up what conferences and events are happening around you. So any presentations, student-run presentations, present. I know this is a research club. If you guys hold a conference, present. Try to present as much as possible. That's a skill you'll find can be very helpful when you're moving on to becoming a physician. You'll be doing grand rounds and all these things. You want to be able to present well. And regardless of if you want to do research or not, you have to be a good public speaker when you're in medicine. So it doesn't matter if it's student run, if it's high level, whatever it is, find what is happening in your city, around you, in your institution, and try to present your research. And then if you have a project that's suitable enough, you should try to submit to a journal. So I know submitting to a journal can be difficult. A lot of journals are very picky, and name institution is institution name is very important, like, oh, you're from London or whatever. So that sometimes is required. That's why when you talk with your preceptor, try to understand their background, what connections that they have with what institutions around the world, and see if they can, after you build a relationship, you can start asking them to help you out with those connections. Whether they can help you connect you with their preceptor in another country so that you guys can submit together. Okay? A lot of projects can also be done online. I have a friend, he's doing this project just completely online with a doctor he hasn't even met yet. He's just doing it, they do video calls, and everything can be done online. So if your goal is to submit to a journal, then just know it is difficult, but there's a lot of physicians around you that you guys can connect with and build relationships with and find out from them what connections that they have with institutions from around the world. So I mentioned, mostly I've been talking about doing journal articles, but if you're someone that's, creative, have very different talents, then you can do anything with your research. It can be art, it can be a podcast, an interview, a film. in our research and medicine program, Dalhousie recognizes that there's not everyone's a writer. Not everyone can write a whole manuscript out. Not everyone wants to present at conferences, so they encourage us to make research in whatever format we want to. So, an example is like, there's a program called Walk with a Doc, where it helps, it's like medical students that assist older people and just walk with them for 1 hour once a week and just have conversations with them. It's a social program. It's not anything to do with writing a journal or anything like that. It's just something to boost these older adult spirits, elderly people who don't have family anymore. You go and walk with them for an hour and just talk with them. So that's a form of research that somebody started at the medical school a couple of years ago. Another one someone started was called Kids Run Club. So in St. John we have a lot of lower economic schools, and a lot of them don't get a good physical education program. So Kids Run Club's a free program where all the us medical students will go in and just go out in the playground, play soccer with kids for an hour. So that's a program that someone started too. These programs are not essentially research, but they're initiatives that they started and they can put on their resume. So when they're applying to residency programs, the interviewers will see that these people have leadership qualities because they started a program, they implemented it, and they got results from it. So anything that can contribute to knowledge translation in any format, do that. It doesn't have to just be a paper. It doesn't have to be a manuscript. You can do whatever you want to do in regards to, just do it well. That's the main important factor. Another thing is to be aware of your time. So I say this mostly for myself. When I first started, my preceptor had like 4 different ideas, and I was like, okay, I'll write all 4 of those papers for you. I'll do them all. And then I got my first exam, and I was like, okay, I don't have any time to do any of this. So you guys, medical school is very busy. You have exams, partners, family, friends. So research can be time consuming, so be aware that when you do meet with your preceptor, you discuss with them your objectives and expectations. So my preceptor is a surgeon, and he only likes to meet at night, at 9 o'clock on Wednesdays. And I'm like, okay, that's not always very helpful. So I told him, listen, I need to study and stuff. Is there a better time we can meet? And if they're a nice enough person, they will understand. My preceptor also wanted a manuscript in at the time we were doing our neuro exam, so neuroscience is coming up, and that's the biggest exam of medical school for us. So I was like, okay, I have neuroscience coming up. Can I submit 3 weeks later? And he was like, okay, no, I understand. So when you do find a preceptor, you'll see a lot of these doctors are very headstrong, they're very strict, which is fine. You should be able to deal with strict doctors, but be confident in explaining your own expectations and your own time commitments, and don't take on many projects if you know you can't finish them. So instead of taking on 3 different projects and doing bad on them, take on one project and just do really good on one project. So just keep that in mind when you're doing your research. And for me, when I started, I knew I didn't want to work with live patients. I work with live patients in pharmacy. It's a nightmare. Working with people, they don't finish the surveys on time, they don't want to talk to you, and then they do want to talk to you, and they spend 3 hours talking about their children or something. It just takes forever. So when I went in, I was like, I'm going to work with cadavers. They're always on time, they're never late, I'm never going to have any problems with them. So that was my goal, and I saved myself a huge headache working with cadavers. But if you guys want to work with population health, or you want to work with live patients, clinical trials, then go for it, do it. But just understand the time commitments that come with research, and don't take on projects if you can't finish it, because that's not going to look good with your preceptor. These are people you also want reference letters from, so you want to be able to show them that you can start and finish a project. So just keep that in mind before you go on to doing a project. And then most importantly, do something that you're interested in, truly, truly interested in. You may not know what specialty you want to do, but I know all of you have different areas of interest, whether it's surgery, orthopedics, pediatrics, clinical or population-based research, just explore that research. I mentioned how in Canada they care about seeing research on your resume, but they don't care about what type of research. They just want to see you can start and finish a project. They want to see that you can take it on, you can write a manuscript, or you can do some format of research. They just want to see that leadership quality. They don't, I mean, if you apply to neurosurgery, maybe one paper on neurosurgery can be helpful, but for me, I thought I wanted to do orthopedic surgery when I went in. I don't want to do it anymore, but I like it enough that I'm going to keep doing my project in it. I find it interesting. I also like working with the CR and X-ray machines, and I like doing clinical research with surgical instruments. So it's all relevant. When I apply to, I think I want to do interventional radiology or anesthesia. When I apply, I can make it relevant. So I'm going to stick with what I'm doing because I'm interested in it and it motivates me to complete the research project. Don't do a project just because you think it's going to help you get into a program or it's going to help you get a good reference letter, because then you're going to be super bored while writing the paper or researching it. You want to be able to do something that you're really, truly interested in, and that way you can do, it won't feel time consuming, it won't feel boring, and you won't be as stressed about something that you're super passionate about. So that's my biggest advice, just do a project you are truly interested in. So that's the end of my presentation. And I left some time for questions too as well.
Hello, so if anyone have any questions regarding the presentation, please.
Hello. Right, so as you mentioned that with Canada it was really easy to actually execute the research. So what exactly goes on when my research involves live patients, like from mapping out the research to actually executing it?
Right, okay. So just to clarify, you asked what actually happens with research when it comes to live patients. So if anything, everything's just going to take longer. You're submitting your research ethics proposal. So if I were to do a research ethics board and I have live patients involved, I have to mention how are they going to be affected? Will they be negatively affected? Is there a placebo involved? Just everything so that they understand that these people are protected people. And is consent going to be involved? Are we going to make proper consent forms? And when I say it'll take longer, if it's something you want to do, it won't take longer. It's not that much longer. So if I were to do it in Canada and I wanted to do live patients, you just have to make sure you explain to them the research project, what's exactly happening, how it's going to affect the population, what kind of data are you expecting, are you deceiving a certain population, are they getting, and will it negatively harm them? Because then you can't do that sort of research. So Canada has had or North America in general, has had a history of just deceitful research happening and people getting hurt in the process. So they have very strict guidelines, and as long as you follow them, you're going to be fine. And you want to have a preceptor that also wants to follow them. So you'll find a lot of these, not a lot, some of these preceptors, I had one preceptor in undergrad, she hated doing ethics board submissions, and she would always cut corners, and I was like, hey, if you get in trouble, I'll get kicked out of university. So you want to have someone that's serious about protecting patients, and they know the rules too, because you're a student, you can search up the rules as much as you want, but if your research preceptor doesn't know them, then it's not going to be helpful. So thankfully, with my organization, they know what we can do, what we shouldn't do, and they help us with these ethical and moral guidelines.
Okay, so when I'm trying to gather a population to conduct my research, are there any incentives involved that I have to provide them with?
Okay, yeah, so that's a good question. That's another thing. If you're providing them with an incentive, you also have to disclose in your submission that I'm providing them with an incentive. So that's okay. You don't have to do it. A lot of the research that happens at Dalhousie is like surveys that they'll do to find out their opinion about something. and they'll be like, if you do this survey, you'll get a $10 gift card or something like that. And you don't have to do it. It depends on the research. You also want to make sure when you're providing an incentive that it doesn't skew the data. So you don't want them to answer in a certain way. You want to get their most honest answer, the most honest opinion about something. And you also don't want to make sure that it's like not blackmailing them, but if there's a population at stake, like a poor population, for example, homeless people, you don't want to incentivize them to do research and force them to do it off whatever you're giving them. You know what I mean? Like, it needs to be morally good and ethically make sense. Like, for example, there's homeless people that you want to work with, and your incentive is that you'll give them a place to sleep for one night. That's not morally a good incentive, right? But if, say, you're doing research with your friends, your student classmates, and you're just sending out a survey, and you tell them if they do the survey, they get a $10 gift card, that's perfectly fine.
Any more questions?
Hello. Is there any opportunity to collaborate with us, like university and our region college?
Okay, so another full disclosure, I'm doing this presentation, my school doesn't know I'm doing it. I didn't disclose it to them because there's too much red tape and all these things that have to come through. So specifically with Dalhousie, or if you want to do a project with Dalhousie, you can try to reach out to a doctor there. I don't think there'll be much help right now. So for you guys, I would say try to do research with people that are in your institution, that are nearby, and collaborate with them there. There won't be much use collaborating with a small school in Canada. But I would say, like, there's a lot of preceptors. I'm sure you have physicians here that have come from different institutions around the world. Or say you want to do a program like in the States or wherever program you're trying to apply to, try to collaborate with them. You might find it difficult to make a connection with those preceptors, but the best thing to do is just email. Send out as many emails as possible. Send out your CV. Explain who you are. Explain what qualifications you have. And also, another thing I should have mentioned in my presentation is that online there's a lot of free research qualifications you can get. All you have to do is you do a course. It's all free, and you do at your own time, and it'll qualify you to do certain research, certain types of research. So just search up like free research qualification courses, and just do the courses. You'll get a certificate and throw it on your CV, and it'll show that you're qualified to do this sort of research. You're qualified to do this sort of research. That will help you also if you're reaching out with institutions to collaborate with them and to be able to do research with them.
I personally doing a research with a doctor who is doing PhD in Australia. So in personal basis, can I not in institutional basis? In personal basis, can I go with them from talks?
So what you said is your preceptor is doing research with institution in Australia. That's what you said, right? And you're saying, if there's any way you can connect yourself with? So yeah, absolutely. But you want your preceptor to help you make that connection. If they're willing to do so, you want them to vouch for you and help support your claim to do the research, basically. You just want your preceptor to vouch for you. Okay, so you can email the program, sure, that's fine, but if you get your preceptor to help you make that connection, like your doctor, is he from Australia or he did his training there? Oh, he's okay. Then ask your doctor to help you make that connection, and ask them if they have any projects you can work with.
Any more questions? Yeah, I think there is none.
Thanks a lot, Siyum. This was a great presentation. We will end our session, but before that, I will give the floor to the.
Thank you so much for your exquisite session. And now I would like to give the floor to Dr. Mohiuddin sir to say something to these research enthusiasts. Sir, please come to the stage. Thank you so much, sir.
Thank you very much for inviting me here. I am very happy to see the audience, and I'm especially happy because I can see a lot of female. They are more interested, and it's very easy to work with female because in my institute, my department, 95% is female. We are only 4 male working in my institution. So thank you, Siyum, for giving the lecture, because I requested him, because we came here only for 2 weeks. I said, we're going there, why not use your time a little bit to make a connection between my institution and your institution. So he accepted that, and I'm really appreciate it. So regarding the things, I don't know whether you noticed something that a lot of times Siyum said, I don't know this, I don't know that. So you need to know, please try to say, I don't know. Because we are learning, because nobody expects you to know everything. So this is very, very important. Always, remember that there is no, shame or anything to say, I don't know. Another thing is that, as a physician, you need to be a good public speaker, you need to be a good communicator, and try to speak, And you know that we in Bangladesh, we talk in our mother language, Bangla, so if you go overseas, you have to talk in English. So some of them you feel shy, don't feel shy. No matter what happens, you can speak, if it is wrong, just keep on talking, keep on talking. One day you will speak, you'll be a good speaker. And nowadays you have, Faisal IT Lab here. I think you can take advantage of that. And there are a lot of online resources like ChatGPT. You can get anything from ChatGPT. This is a very good resource. And YouTube also there. So for you guys, I think sky is the limit. And if you don't do the research, even you can do case study, small case study, write it down, publish it, send it. At least 50 journals you send, no one will accept it. Case study, start with the case study, that is the best way to go. Then you can go for, formal research, the way you do it. So I hope, the main reason I told Siyum to come and give the presentation, to make a connection, because from our, generation, a lot of physicians working in the USA, Canada, UK, Australia, New Zealand, and our next generation kids now in medicine, a lot of them. So, but because of the language barrier and the environment and all these other negative thing about Bangladesh, they have less connectivity. So my intention to bring him here and to make him to give this speech, to make a connectivity with the next generation. And mashallah, you guys are very, smart, because among the 110,000 students, only 10,000 picked up for medical education or admission, and only 4,000 in the government institute. So you guys are smart. So you can do it, there is no doubt. But keep on studying and keep on doing, keep on publishing. Thank you.
Sir, I would like to say thank you so much for your valuable words, for our young research enthusiasts. Actually, we got a very vivid idea about how to start a research paper from our very valuable speaker. Thank you so much, Mr. Siyum Mohiuddin. We will wrap our session within 5 minutes. I will say our guest and sir to stay for a few more minutes. Now I will like to give the floor to Omar. He will brief something. Thank you so much.
হ্যালো গাইস, আমি আসলে ফ্লোরটা চেয়ে নিয়েছি বিকজ হচ্ছে আমাদের যেটা অনগোয়িং অ্যাসাইনমেন্ট আছে সেটা সম্পর্কে একটু কথাবার্তা বলার জন্য আর কি। খুব বেশি মানুষ আসলে এখনো পর্যন্ত সাবমিট করতে পারিনি, প্রবলি সবারই ক্লাসেস চলতেছে, এক্সামস আছে। বাট ইভেন আফটার দ্যাট কোনো পার্টিকুলার ডিফিকাল্টি কেউ কি মেনশন করবা যে এই জায়গাগুলো হচ্ছে হয়তো একটু টাফ লাগছে বা কোনো হেল্প লাগবে কিংবা লাইক এনিথিং?
ভাইয়া মেস্ট টার্মে কি কোনো সেশন হবে?
হ্যালো, হ্যাঁ,
মেস্ট টার্মে
নেক্সট টার্ম করে সেশন হবে ইন ফিউচার হোপফুলি। বাট আপাতত তোমরা যে কিওয়ার্ড গুলো মানে বুলিয়ান অপারেটর দিয়ে এন্ড অর ভাবে যেটা ইউজ করে হচ্ছে সার্চটা করবা, ওই কিওয়ার্ড গুলো হচ্ছে কপি করে অ্যাসাইনমেন্টের ওই বক্সটাতে দিয়ে দিবা, কেমন? স্পিকিং অফ দ্যাট, যে পিডিএফটা গ্রুপে দেওয়া হয়েছে বা যে ডক ফাইলে দেওয়া হয়েছে ওটাতেই কিন্তু সবাই এডিট করতে পারবা। মিনিং লাইক নতুন করে আবার পুরোটা লিখতে হবে না, অনেক বড়। আই নো এটা এক উইকের জন্য হয়তো টাফ, স্টিল ট্রাই করো। গত উইকে তো দেওয়া হয়েছে, সো আই হোপ নেক্সট উইকের মধ্যে সাবমিট করা ট্রাই করবো সবাই, কেমন? জাস্ট যেই বক্সের মধ্যে লেফট কলামের জিনিসটা রাইট কলামে হচ্ছে তোমার ফাইন্ডিংসটা কিংবা তোমার টেক্সটটা ডিরেক্ট কপি পেস্ট করে বসে দিলে হবে। ওই টপটাকে এডিট করতে পারবে তোমরা, নতুন করে আবার পেস্ট করতে হবে না। এনি মোর কোশ্চেনস? 62 মানুষজন কি করতেছিস তোরা একটু অ্যাসাইনমেন্টটা কর, বিকজ আই থিংক মানে বাকিটা হাতে তো অনেক সময় আছে, আমাদের তো সামনে ব্লক শুরু হয়ে গেলে আই ডোন্ট থিংক আমরা খুব বেশি আর কাজ করতে পারবো। ওকে, আচ্ছা আমি আরেকবার নতুন ব্রিফ করে দিই ব্যাপারটা। বেসিক্যালি আমরা 3টা টপিক দিয়েছি এবং রিলেভেন্ট 3টা হচ্ছে আর্টিকেল দিয়েছি। এই আর্টিকেল থেকে যে কোনো একটা আপ টু ইউর লাইফ আপনারা